Okay, well, hello everybody. It's Lynn Wemyss. It's Live at 5 Fridays on A Different Kind of Better, and I'm so excited to be back here again on Friday. Today, we get to talk to Dr. Tom, and I'm really excited about that because finally you get to meet the doctor behind me, the person that gets to collaborate with me and help me with our clients. And you get to know him as a person and we get to talk. So a lot of people are saying to me, how does that work? How does a natural healthcare practitioner collaborate with an MD? So today we want to address that. We want to see if we can sort of let you guys know that it's possible and it can actually happen and that it does actually help. So let me introduce you to Dr. Tom. Dr. Tom is a family practice physician in London, Ontario. He's been practicing for many years, has a very busy clinic, and has helped many, many people. So I'm going to let him introduce himself actually and just talk a little bit about what he does. So Dr. Tom, maybe you could tell us what kind of practice you have right now.
Well, it's an eclectic practice, which means it draws from a whole lot of areas. Had multiple different types of staff. Some understand Reiki, some understand neuro-linguistic programming or clinical hypnosis. Some understand Reiki or Feldenkrais or Traeger, chiropractic. So we've got a wide number of people that we've had within our own clinic over the years, but as well we've contrary to what many physicians do, we do make referrals to chiropractors, we do make referrals to dietitians, and we value their input as well. The alternative, they're called alternative, but they're complementary practitioners, have something to do, and they help the patient to sort out what's going on with them, and we can get feedback from those practitioners and then integrate what one person is doing with what the other person is doing, and as well integrate that with 4 or 5 different consults that the patient may have had with regular physicians. And the end result is we get you another pill. The end result is, I'm sorry, this is what you have and you're going to have it for 30 years. Now we have nothing else to offer. And but we'll check on you in the next 3 months or 6 months' time, see if you're any worse or any better, or we can change the color of the pill. So our approach has been to empower patients and to value what the patients are doing on their own. They're seeking information from internet and seeking information from people that they can trust. So we're quite familiar with those kinds of inputs in terms of helping people to solve the problem as to what's the matter with me.
Yeah, actually, it's kind of funny that you brought that up because that is huge. It's one of the first things people say to me. I've been everywhere. I've run the gamut. I've seen specialists. I've, seen a few different people, even sometimes in the natural healthcare field, but they still have no answers. And we find that people are definitely looking for answers. So basically, what do you think the main difference is going to be in a collaboration between myself and you in a different kind of better clinic, and how do you feel that's going to help people in the future?
Well, we're not a one center that treats everything. We have to rely on what the patient's choices are, the client's choices are, and some of them have seen colonic therapists, some of them having foot massages or ionic baths or massages, and those practitioners have a wealth of information about that particular patient, and they can reflect to that patient their own impressions as to where the patient needs to go next. There are some things that they don't have skills in. And for example, what kind of water are you taking? Well, I'm taking 8 glasses of water a day because somebody told me to do that. Well, that's not okay because it dilutes your digestive juices and you get into trouble. So it depends on the kind of water that you have, and it depends on what kind of food you have. So there are blocks in perspective that we can help to understand what the puzzle is and how the puzzle pieces fit together to give us that that picture of health. So a different kind of better has a technology, European technology, that helps to coordinate information data that gives an idea as to what direction the person needs to go. And perhaps they've forgotten that, oh, it's not normal to have a bowel movement once every 10 days. Oh, it's not normal that I wake up every morning at 3 o'clock in the morning. Well, that's related perhaps to the acupuncture pathway. And so we find those nuggets that we can reflect back to the clients and allow the information technology to go deeper into awareness for the client.
I'm going to kind of put you on the spot now, Dr. Tom. Here comes the big question. So this isn't something that you see very often. And I think you know that you'll have to admit that, right? That you don't see, although I will admit that I'm seeing more physicians be more open and more acceptant of vitamin and mineral therapies, and moving in that direction, you know, having a little bit more of a nutritional background, but you don't see such a huge acceptance of acknowledging the fact that natural healthcare practitioners have some value. So what happened? What shifted you a little bit into realizing that it could actually be beneficial to not work alongside, but to actually collaborate with them?
Part of the reason for that was in having family with illness. Part was the fact that I hit a tree when I was 19 years old and bent the steering wheel up with my chest and banged into my head as well. But I didn't know I'd been injured until when I was about 40 years old. My best friend managed to whack my head really quite severely with a squash racket. I hit the ball and it hit my head and drove me into the concrete wall of the squash court. I had a choice then to start taking ibuprofen or pain medication, but I knew I wasn't going to do 1,000 pills a year. And so that led me into looking at certainly chiropractic understanding, applied kinesiology, to look at stress management and clinical hypnosis, to clinical nutrition, look at Jeffrey Bland's work, look at some of the companies that are really 10, 15 years ahead of the normal medical approach. And so I didn't take medication, but I managed to change the practice from seeing 40, 50 people a day and delivering babies up to 1,500 babies. And I've changed finally into a practice where we spend time with our patients, sorting out where they are, whether it's psychological or whether they've got some trauma going on, whether they, for example, one individual said, I'm really dizzy, I'm using my wife's pills. The wife was not a patient of ours, but that's the only way I can sleep. And I said, well, why don't we just look and see what your lifestyle is? He had puff of cereal in the morning, nothing else to eat all day long, and he had 2 to 3 coffee a day. And I had to explain to him that maybe we should look at the caffeine. Whereupon he tells me that it was 3 to 4 pots of coffee that he was having a day. So it was basically just on adrenal overload, and he wanted some really strong pills to settle that down. He could not even stand on one foot without shaking, and his gait pattern was off. So some people are open to learning something new. That wasn't his case. So that's where I've come from. And of the 75 physicians in the program that I had many years ago, there's only 1 or 2 of us left in practice. I have no intentions of licking a golf ball on 18 holes 3 times a week. I would prefer to write a book, but I think this is a very excellent way to help people move with confidence and some special skills and support into a better way of health.
Wow. So yeah, well, thanks for sharing that with us. You know, it's funny. I've known Dr. Tom for most of my life, actually, and we think a lot alike, but that was something that even I didn't know about him. So that's really nice that you were able to share that with us. So there's a lot of different types of clinics around. There's a lot of different naturopathic, homeopathic, all different types of small businesses all over the place offering natural health care. So in your opinion, what will make a different kind of better clinic a little bit different? And how will it help people that are struggling, that are not getting the answers that they want?
Well, first off, they have to have an idea of what they don't know, and that's what this information technology will help them with. For example, they may not remember that they lived beside an orchard where they were spraying trees, or they were living in a chemical valley, and that was many, many years ago. Or they may well have been a truck driver and not realized that the cement roads go from a cement color to a tarvia color because of the oil and the grease at the high temperature as the tires and the trucks go over the road. And then that stuff gets vaporized. So the truckers go to sleep because they have these toxic things that sometimes their body can't deal with, let alone the tremendous stress of long, long hauls. The idea for us is to uncover some of those nuggets and allow clients to figure out, okay, we've looked after this area, we've looked after the physical, maybe we should look at the immune system, maybe we should look at the nutritional system. Are we actually digesting the food? Because we're not really what we eat, we're what we digest and properly absorb. We can also look at the emotional life, or epigenetics. Epigenetic is the study of what the genes can do wrong. It's a belief that says the genes don't do anything unless the environment turns the genes on or off, and that's well understood. We can also look at the biome, which is the collection of 4 pounds of organisms, not poop, but 4 pounds of organisms within the large and small gut that actually are paramount in helping with the immune system, especially if those organisms or byproducts get into the liver and excite the liver, and then you get something called cytokine storms, or you get bacterial overload, which bothers the whole immune system and puts the person at risk. So we allow people to find the steps that they're taking, and then find out what they're learning. And they go from grade 1 to grade 10 to university. But commonly people get stuck at a certain place, and I've tried everything, but I don't know what I'm missing. And that's what this process is about. How do you find a better way? So a good expression is good, better, best. Never let it rest till your good is better and your better is best.
Although it's kind of a tongue twister. So you can see, Dr. Tom and I are very comfortable with each other. And I think that's really important when you're working, alongside each other, and you're collaborating on different patient-client issues. So I want to talk a little bit about how we work. We are a clinic, and we have some very sophisticated equipment. We have some analysis tools that not too many other people have. And that is why we call ourselves a different kind of better. We go above and beyond, and we care about the patient or the client. And we want to make sure that people understand that we have their best interest at heart. We listen to what it is that they have to say. And we know both of us have been through illnesses, or myself a critical illness for 2 years, where we've been on the other side of the table. And I think sometimes that's really important as a practitioner to understand where people are coming from, and why they struggle, and why they want to know, and why there's this definite search for something that's going to help them, looking for that root cause, right? Having the ability to be able to analyze it and know which direction to go in, so that we can give you the correct information. For me, seeing a client for the first time, because I'm the one who does all the pre-workups, and then you have the opportunity to actually have Dr. Tom involved in your care as well. It's nice to know that when I pass that on to Dr. Tom, that he's going to look at it from a medical perspective and make sure that we are actually looking at everything. Nothing is going to get missed. So my personal belief is that if we can't figure out what is going on, there's not too many other places that you can go to. And we've made it so that it's affordable for people. So why is this Live at 5 coming to you with the intention of talking about can an MD and a natural healthcare practitioner work together? You need to understand that it doesn't happen very often, but we think it should. And we believe that, you know, we're hoping that more and more people in the medical profession, more people in the alternative healthcare profession stop competing, and that we start realizing that we, all of us in our fields of practice, have certain skills that can be utilized to help a patient get better or feel better and have a better quality of life, because that's what it's all about. When something happens like a traumatic illness or a traumatic event per se, it changes your whole life. And if you don't have health or you don't have that same quality of life, it can affect a lot of things. And people just settle, right? Would you agree, Dr. Tom, that they just settle sometimes?
Well, they more stay confused and confused about what direction to go. And should I continue on with the chiropractor? Should I continue on with a nutritionist? I'm doing everything that I'm supposed to be doing, but what am I missing? So our job is to help people to understand what they're missing. What they're missing is that joy and that spark that says, I'm still here and I can contribute to my family, I can contribute to my friends, but it's an imprisonment in a perspective that says, I'm really stuck here and I'm stuck in this muddle, this muddied water, and I cannot see a way out. Would you please help me? And that's what we're about. It's not so much the knowledge that I have, because it's hundreds of thousands of dollars of courses and training, and we could go through all those qualifications and the knowledge and experience. What we want you to understand is we're here to care. We're here to care, to listen to what's going on, to listen to the technology, and to give clients choices as to whether they're going to take a vitamin if they like, or what kind of vitamin is a safe vitamin, or to continue on with their Reiki practitioner or their foot massage person. All of those contribute, but people run out of funds in order to do all of that stuff. So how do we make it more affordable for people to focus in on what the priorities are that come up?
Yeah, and so would you say that we're working on a more cellular level?
Cells have a memory, and the memory goes from system to system. And if you look at what the acupuncture system is about, it's about some information highways that say, oh, the large intestine is at from 5 o'clock to 7 o'clock in the morning. That's the time for the dump to dump to dump. Heart attacks most commonly take place in the heart acupuncture time period from 11 in the morning until 1 o'clock. Asthma happens often between 3 o'clock in the morning to 5 o'clock in the morning. And those are systems that are communicating. There is an electronic pathway system through the acupuncture 5,000-year system out of China. Sorry for China, but we need to follow the meaning and the understanding. And when those systems are not communicating and they're not flowing in the way that they should, then the patient is blocked and they just can't understand why that chronic stuffy nose is there. They can't understand why the TMJ or the jaw is biting down. They can't understand the pain between their shoulder blades or the recurrent swelling of their belly. And it's not so much about more tests. Patients or clients would bring that information in and allow that to be reviewed. And it's very silly if we leave out one part of the picture or the other part of the picture. Someone who has never seen a medical doctor for 5 years and has not had some sort of general or partial workup, including blood tests or whatever, as an advisor, I would make a determination that says, well, maybe that's something that you need to do before you go further on with the fact that you're fatigued and you've lost 20 pounds of weight.
Wow. So There you have it. So I hope you enjoyed today. This is a physician's perspective on, you know, how things can change. And it's also my perspective on the fact that this is something that I've wanted to do and been passionate about for years, and it's finally come into fruition. So we hope that if you're struggling and you're looking for some answers, that you'll give us a call. We're on A Different Kind of Better on Facebook. We are a different kind of better clinic.com if you want to get us through our website. And you can also reach us healthcare practitioners if you're interested in finding about and being part of A Different Kind of Better, which is a platform for all healthcare practitioners, wellness practitioners, I should say, that want to be heard, that would like an opportunity to educate the world on a platform where we all come together and work together and collaborate. Please take a look at that website and see what it can do for you. Trust me, it's really exciting to know that we're going to be part of changing things in the future. I'd like to give a big shout out to Karen Ansel McKinnon, our IT guru, I call her. She is the person that is, working this platform and helping us build it. We call ourselves a partnership, but really it's mostly her than us that's making this possible for us to get the word out globally. So thank you so much. We hope to see you again. Please tune in next Friday for our Live at 5, and I'll be posting the topic shortly. Take care, and we hope to see you soon. Thanks for tuning in, everybody, and thanks for coming in, Tom.
That's great, and there's much more to come.
Yes, that's so true. Take care. Good night, everybody. Have a great long weekend.
Super. Bye now.